Well, good morning. This is Tom Parry at the Integrated Benefits Institute. Good morning for the West Coast people and good afternoon to our East Coast members. I appreciate the opportunity to spend about 30 minutes with you this morning talking a bit about IBI's work and where we're headed in 2014. And somewhat remarkably, at least from my standpoint, since I was here from the beginning, this is our 19th year here at IBI, and we've kind of dubbed 2014 here on staff as the year of member engagement. So we're going to spend a lot of our time working with you, the members, this year, and really bringing to you the results of our work and working closely with you. So let's take a look at where we're headed as we move forward. Let's take a first look at the starting point, where we see employers are these days and where they're headed in 2014. And I think what we're seeing right now, simply because of healthcare reform in 2013, a tremendous focus on tactics in 2013 and responding to healthcare reform strategies for managing health and business-relevant outcomes is what's coming up next. So a movement from tactics, how do we deal with this new legislation, to the broader issues. Once we've thought about how we're going to finance healthcare and cover our employees, what are we going to do strategically about managing health and business-relevant outcomes? Separate decisions than financing healthcare, and obviously very important ones. Secondly, and I think the reason for this is the C-suite is really focused on the value of improved workforce health. Why are we doing this? What are we getting from our investments? There's a new conversation between CFOs and VPs of benefits, HR directors, and even risk managers around these issues of health improvement and what it means to the business. So as we've worked with employers over the years, we have really seen employers realize it's a dead end to try to attempt to control claims costs in separate program silos. You can't manage costs by managing claims. You can only manage costs by managing health and health outcomes. So employers are looking for new and better strategies to manage workforce health, reduce lost time, enhance productivity, and improve the impact of health on the business. As employers see this, they also say to us that we have limited data, limited time, and limited dollars. How do we proceed? So our agenda this year, we'll talk about each of these four areas today. Research, employer case studies and profiles. It's a growing part of our work here at IBI. Our work in benchmarking and modeling, and our work in education and communication. So I'll touch on each of these topics as we discuss 2014 today. In our research area, we're really going to focus our work on two things. One is really focused on expanding the health and productivity model. How does all this stuff fit together? And I think one of the most important parts of this from our standpoint is IBI has acquired two new databases for our research this year. They are databases that look at the world longitudinally. They are employer and employee-centric and multi-year. So that actually allows us to look at how people change over time. Instead of looking cross-sectionally at 1 year and essentially looking at how one person changes and hoping that someone else with the same characteristics improves the way that person is. So having longitudinal data for research is critical for really better understanding how health and productivity are connected. One of the research projects we have just begun is looking at the impact of health improvement over time on medical and pharmacy costs, but also on lost time and on performance. So the question here is, what happens, by how much, and when does it happen? And I think for the most part, many of employers, when they've thought about wellness, have really put all their eggs in the medical and pharmacy cost savings basket. And they really have ignored issues of lost time, disability, and performance. And we want to connect all these and see how these things happen over time and in what magnitudes. Another area of work with our new longitudinal databases will be focused on medication adherence and gaps in care. Again, connecting all these dots over time, not just on the medical and pharmacy spend basis, but on these other dimensions of health as well. So employers can start to see the bigger picture, particularly as that bigger picture develops over time. One of the other areas that's very important to us is to improve measurement. And one of the projects we have ongoing right now, Dr. Kim Jeanette, IBI's research director, is the principal investigator for this project, is better measures of workforce performance and its impact, and working with some of the leading academic researchers who have developed self-reporting tools to really try to move ahead this issue of how do we look at performance around health, measure it more effectively, and understand what it means to the business. But we also recognize there are some broader issues that are related to health but have a significant impact on business performance. Some of you may have read a few months ago our work looking at the impact of stress on absence from work. And we found a very interesting and important thing, that stress, in fact, does affect health, and health affects absence. But we also found that stress affects absence directly. And what it tells us is that there are some broader issues that we need to pay attention to beyond and outside our traditional way of thinking of healthcare, like well-being, corporate culture, corporate structure, because the focus is rapidly shifting to how all this connects to business performance. So some new areas of our work here at IBI in 2014 will be to understand other employer influences on business performance beyond the traditional healthcare issues that has been part of the healthcare policy discussion, part of the health outcomes discussion. But also, we're going to look at the impact of non-participants and the difficult to engage. That really, I think, is where a lot of the answers to the healthcare crisis, the healthcare challenge is going to come, is how do we reach those people that have been difficult to engage or haven't participated in programs, because they drive costs as well and they drive outcomes as well. So a lot of our work will focus on these new areas in 2014 as well. As I mentioned earlier, we've found that employer case studies are very, very rich. As we look at this question of evidence, what's the evidence tell us about the management of health and productivity and outcomes? As researchers, we always tend to look first at the research literature. But we've also found that there's very strong evidence in what employers are doing. And so when our members think about evidence, they really think about evidence in those two ways. What does the research tell us? What do employer case studies tell us? So we'll be doing more work this year directly with employers and with our other members and their clients around generating case studies of employers that are doing creative things in managing health and productivity. So one of the, I think, the growing issues that we're hearing about from employers is the question of, do benefits and risk managers have anything to say to each other? That is, are things that happen in those two programs related? Do the same people utilize both programs? Are similar conditions treated in both programs? If they are the durations different? So we see a growing conversation between benefits and risk about working together to help improve workforce health, but also business performance around absence and disability and the like. Secondly, for several years we get a lot of questions about call centers. Many of our employer members have call centers, and they really want to better understand are the leave patterns in call centers different than in other parts of the organization. We're developing a project with the Silicon Valley Employer Forum to look at some of their member companies in the high-tech industry around call centers and call center leaves. So again, an employer focus, relatively small number of employers, but a very rich opportunity to understand the reality of these things for employers. Now, in these broader areas of work, really focused on employee engagement and health behaviors, we'll be working with our members that are as employers being creative in doing these things, or as suppliers working with leading edge employers to do case studies about successful strategies around employee engagement and health behaviors as they relate to the broader outcomes that, of course, we traditionally focus on. Corporate culture and structure. Again, some of these other issues, we published a case study this past year on Lincoln Industries, one of the really remarkable case studies of a relatively small employer that's done great work on building and maintaining a corporate culture of health. And finally, well-being, a growing body of work around well-being, both from the standpoint of research literature, standpoint of what employers are doing, really, again, broadening this discussion beyond the traditional healthcare issues. So again, this will be an area that we want to explore, and we think that good case studies are a way to start to learn more about this so that good research can be done going forward. We also want to enhance the number of very brief, quick employer profiles. Some of you that have visited our web page and gone to our knowledge bank have seen we have the opportunity in a very straightforward way to profile employers that are doing creative things. So again, really focusing on employers, profiles, and then full case studies. We'll do a limited number of full case studies with employers this year. And I really recommend to our members on the call here, this is being recorded and we're going to put it on our website, that you let us know if you as an employer are doing creative things you'd like us to profile. We don't have to put your name in it if you don't want. Or you as a supplier are working with leading edge employers that we would like to work with as well. Now, many of you know that we have spent several years building very large benchmarking databases and modeling programs. IBI continues to have really the biggest and only benchmarking database for lost time programs, short-term disability, family medical leave, long-term disability, and workers' comp in the country. We have more than 52,000 employers in our database and 4.4 million claims. Now, what that allows us to do is build industry benchmarking databases at the SIC code level. So we have about 895 different industry groups in that database. And those industry benchmarking reports are available to our members, and I really recommend that you follow up with us if you're interested in getting access to that information. We've simplified the benchmarking reporting structure. This year we're going to revise our workers' comp data collection and reporting. Really, again, back to that issue of the conversation between risk and benefits. So our benchmarking work, I think, is one of the really important and key assets that IBI has to bring to our members, to help our member companies do a better job of understanding how they compare and where they may make improvements. On the modeling side, really two major modeling efforts, two major models that IBI has built. This has been led by Dr. Brian Gifford, one of our senior researchers, and Dr. Kimberly Jeanette. The impact of chronic health on lost time and productivity. It's a model that allows us to take characteristics of an employer, demographics, business, number of employees, and actually model for that employer the kinds of chronic health conditions they would expect in a workforce like theirs, and not just the chronic health conditions that are being treated in the medical system, but what chronic health conditions are likely to exist in the workforce and how those conditions affect lost time and lost productivity. So it's a way for employers to think more broadly about chronic health, their disease management programs, and outcomes that may be important, that they may be missing today. And the other area of our modeling work, we call it the full cost estimator. It's a model that we built that actually allows us to model for virtually any employer what the total cost and impact of health is in their company. Medical, pharmacy, disability, workers' comp, incidental absence, performance, productivity, all of that, all the pieces of the real impact of health to really help employers start to get their arms around this, even when they don't have all the data themselves, and most employers, as we know, don't have all the data. It really helps them start to see the magnitude of health and start to think about their programs and outcomes and strategically where they may want to take this conversation. So I really recommend to our members that are interested in these areas, benchmarking lost time, broadening the discussion about chronic health in your companies, and certainly looking at the total cost of health, by all means, reach out to us and we can help you do those very things. In our education and communications area, we hired about a year and a half ago our first full-time communications director, Alex Dolan. Many of you have been in contact with Alex, and he's done a great job at really ramping up and bringing our communications program perhaps into the 21st century. And one of the things that I really would very much like to make sure you're aware of, and you probably have already been aware of this because we've communicated about it a lot in the last month, is our National Forum on Health, Absence, and Productivity Management. March 3rd through the 5th here in San Francisco. We have on the screen the address where you can get more information. It really is a terrific program. We had more proposals to speak at this forum than we've ever had before. It was highly competitive, something like 75 proposals to speak for 17 speaking slots. A terrific group of companies. Employers are always the one that have the strongest voice in our forum. And it's a great way to not only engage in learning about what's going on in the cutting edge, but also to network with your peers in a non-commercialized environment. So it's going to be a terrific meeting. Love for all of you to come to that, or at least to have a representative of your organization be there. We'll continue to publish our IBI research insights. We'll do that on an every other month basis because we have so much on our plate in these big research studies. But you'll hear from us at least every other month in our research insights, and as I said, a growing number of employer case studies. We do hold webinars when we publish new research. We'll continue that in 2014. Something new in 2014 are regional workshops. You know, in the past we've really had our national conference, and that was kind of our one time to get together face-to-face with our members. But our board of directors has said, you know, why don't we take it out on the road, if you will. So we're going to host several regional workshops in conjunction with employer members. So right now we have one lined up with Home Depot at their home office. We have one lined up with Walmart at their home office. 2 employers on our board of directors will be reaching out to other employer members to co-host regional workshops with us, bring together our members in a region to have a chance to really talk together and hear some of the latest things that we're doing, hear from employers as well. You know, one of the things, as I said earlier, is to try to identify and reach out to employers doing creative things. And so we'll be working with our employer members and our supplier members and their own clients to do webinars with leading employers. So we're trying to find a variety of different ways to reach out to you, our members, not just through written reports, but new ways in communicating with you to really bring the latest in what employers are doing, what IBI's research is telling us, to our members in a way that suits their needs. We want to focus on expanding the knowledge bank. If you haven't been to the website and you're looking for information, the knowledge bank actually allows you to search for topics either in the research literature or through employer case studies. So it's a very efficient way to get information, to get evidence with these 2 views of the world, peer-reviewed research or what employers are doing. But we really want to hear from you. One of the reasons that I wrote this Outlook document, the one-pager that all our members got about a week ago, is we want to hear from you about your interests, your needs, your questions, so that we can meet where you are based on what you need. So by all means, we want you to reach out to us as we reach out to you so we can do a better job of taking the work that we're doing here and really making it relevant to you, useful to you, so you can deal with the real-world problems that you all deal with every day. So here I wanted to end my part of the discussion, and I'd be certainly happy to open it up for questions or comments, with just some contact information that you can jot down if you want to reach out to particular staff here at IBI. The website, as you probably know, is www.ibiweb.org. My number, 415-222-7282. That's our direct line, my direct line, and 7280 is the main number that Janice Parry, our executive assistant, will answer the phone at that number. For research questions or issues, please contact Dr. Kim Jeanette. You can see Kim's email address and telephone number. She's been with us for, probably how many years? 8 or 9 years now. Terrific researcher, one of the most knowledgeable researchers that I've ever come across, and we're very, very fortunate to have Kim directing our research program. So for those of you interested in research or have questions about the research that we're doing, certainly reach out to Kim. Benchmarking and tools, Schuyler Parry is the contact here. His contact information is on the screen here. Schuyler's been really building our database now in benchmarking for 4 years and has been responsible for that. So any questions around benchmarking or getting access or the like, please contact Schuyler. Employer profiles and case studies. Alex Dolan, our communications director, is the point of contact there. So if you have an employer that you'd like to profile or do a case study in working with us or our employer members directly, contact Alex. For those of you who would like to add colleagues to our distribution list, because our membership is corporate, anyone in your organization can get access to all of IBI's work as part of your membership. And so if there are colleagues in your organizations that are not getting our materials, or if anyone on the phone for your companies is not getting our materials, you can email my executive assistant, Janice Parry, at this email address on your screen. We also have the opportunity for employers to get access to IBI's work at no cost. So employer memberships are really a no-cost operation. So for employers on the phone, these are primarily our members, but if you have colleagues in other organizations that are struggling with these issues and are looking for independent view, one of the reasons we started IBI as a not-for-profit in 1995 is to be independent. We don't sell services. We don't sell consulting. We don't sell solutions. We really want to focus on what the data tell us, what the data tell our members so they can do a better job of solving the problems they have to solve. So employers can join IBI at no cost. Certainly for our supplier members, any of your clients can take advantage of this opportunity as well. And as you can see here, there's the web address where employers can sign up online for no-cost employer membership. Anything else, by all means, you can contact me anytime. Here's my email address and telephone number on the screen. We really want to make sure that we're meeting our member needs and doing the work that our members find as valuable. So with that, we have a few minutes left in the half hour, and I went through things quite quickly. But I wanted to make sure I touched on some high-level things that we're working on, being very mindful of time that we have. We know how busy everyone is, now getting ramped up for the new year. But I appreciate the opportunity to talk with you a little bit about where IBI is headed in 2014. As I say, this is the year of member engagement. We're here to meet your needs, and by all means, let us know what we can do to help. So with that, I'd be happy to answer any questions or hear any comments before we wrap up at time.
All right. Tom, this is Chris Desi, Bristol Myers Squibb.
Hey, Chris.
Hi. Thanks for a nice overview. Here's my question or request. Can the case studies will be based on an employer specific experience, right?
That's correct.
Is it possible for those case studies to provide some sort of editorial? There are two ways to approach this. I suspect that I understand case studies will deliver broad recommendations, but I suspect it may have different impacts depending on the size of the employer. Is it possible for a case study, if it's a large employer, to have some editorial on what the anticipated or expected impact would be on small employers, or can we have a mix, or can we have a mix of case studies that have large, small, and here's why I say this. Health is an investment, and some folks might not have enough investment to be able to deliver on it. And I think that's to gain the benefit over the long term.
Chris, I think that's a terrific idea.
Okay.
We all know that there are two of the key features are industry and employer size. Obviously, demographic makeup is part of that. So I think this is a great idea to take a topic that is of interest broadly and then reach out and try to find employers in different segments that can participate so they can enlighten employers in this group. So that's a terrific idea, Chris, and we'll bring that forward. Thanks very much for this.
Okay, and I look forward to chatting with you about that over a glass of wine, perhaps.
Yeah, I love to do that with you, Chris. Thank you. Any other questions or comments from the members on the call today? Okay. By all means, sometimes people are a little shy at talking, with 130 people on the phone. But please contact us, and we have the contact information up there. When you have questions, contact the individuals we have here on the screen because, as I say, we're really here to support you in this conversation about the business value of a healthy workforce. So thank you all very much. I look forward to seeing as many of you as possible in March at our forum atop Nob Hill at the Fairmont Hotel in San Francisco. And for those of you who were at the forum 2 years ago, you'll remember the terrific view from the top of the Fairmont at our reception the first night, and I certainly hope to see you there. And I look forward to hearing from you and working with you during 2014.
Great.
Thank you all very much.